Hello everyone. So today we will discuss about a case of multiple sclerosis, and it is an autoimmune disorder of our central nervous system, and it commonly affects the females who lives in cold areas like Jammu and Kashmir or Europe. European females and females living in Jammu and Kashmir are more commonly affected by multiple sclerosis. Okay, so this patient was 34 years of age and she was a native of Kashmir. And she presented me with the symptoms of blur vision with pain, that is known as optic neuritis. And she developed optic neuritis before 2 years. Before 2 years, when she was residing in Kashmir, and after developing optic neuritis, she developed fatigue, and after fatigue she developed abnormal gait and tingling of both upper and lower limbs and profuse urination. And uh, symptoms like optic neuritis and profuse urination, these two are the most commonest symptom of multiple sclerosis. And a patient of multiple sclerosis can also develop other symptoms like disturbed speech or imbalance, or symptoms like discoordination or auditory symptoms if these areas of the brain gets damaged. So later on I will tell you about the pathophysiology of these symptoms, that why these symptoms are developing. So now the diagnosis. This patient was asked to go for MRI, and her MRI shows damage in the brain and the spinal cord. So the name multiple sclerosis. So multiple means multiple focal areas of the brain gets damaged, and sclerosis means hardening of any tissue of our body. So what happens in multiple sclerosis is that the axons of the neurons gets damaged due to multiple or repeated attacks on them. And in her MRI, her optic nerve was damaged, so she was having optic neuritis, that was blurred vision with pain, and her dorsal part of her pons was also damaged. And this area of our brain, dorsal part of pons, it controls our urinary system. So she was having excessive urination due to this. And that patient, she told me that she had to go to closet in every 5 minutes. Means in every 5 minutes she was developing urge to urinate. Then there was damage to her motor cortex, and due to which she was having muscle cramping and difficulty in walking, and inability to rapidly change her position, and tremors. Sometimes she used to develop tremors and numbness, and or tingling sensation in her lower limb, and also fatigue and difficulty in speaking because there was damage to the Broca's area of her brain. And her attendant told me that she developed difficulty in speaking just before 2 to 3 months. And she was having fatigue because this symptom fatigue always develops when there was damage to the myelin sheath of the neurons in cases of multiple sclerosis. And due to this damage to the myelin sheath of the neurons takes extra energy to send signals from one neuron to another, and it sometimes causes disturbed sleep. So due to these two causes, disturbed sleep and neurons taking extra energy to pass the signals, so the patient develops fatigue. So now the pathophysiology of multiple sclerosis. So what happens in multiple sclerosis is that it is an autoimmune genetic disorder, means uh, the genetic predisposition for this disease is already present in the body of the patient. So what happens in this disease is that um, there is presence of autoreactive T cells, and these autoreactive T cells are asked or directed towards the myelin sheath. They are asked to damage the myelin sheath of the neuron. So let me draw a diagram of axon. So this is a neuron, and this is the axon, and this is the myelin sheath. These are the axon terminals. So what happens is that due to presence of autoreactive T cells, or the T lymphocytes, these T cells, they are asked to damage the axon. So they cross this myelin sheath while damaging the axon, and this myelin sheath is getting inflamed due to repeated uh, attacks from the autoreactive T cells. So this is known as inflammatory demyelination due to repeated axonal injury. And this inflammatory demyelination is causing all the CNS lesions. This myelin is essential for impulse conduction from one nerve cell body to another. This is the normal function of the myelin sheath. And what is happening due to this inflammatory demyelination is that repeated attacks on the myelin sheath leads to lesion scar-like lesion, and this scar-like lesion is also known as plaque or sclerosis. And due to development of this sclerosis, there is degeneration of the neuron, of that particular neuron, and due to the degeneration of that particular neuron, all the CNS symptoms are developing. So this is the pathophysiology of multiple sclerosis. So now the risk factors which are responsible for development of multiple sclerosis. The first is, as I told you before, genetic predisposition, means family history, and the second one is environmental factors like people living in colder climate, and females, and smoking. Smoking is very much responsible for the development of multiple sclerosis. And homeopathic management, uh, we can prescribe the patient gelsemium uh, when the patient is having optic neuritis, and alumina, um, alumina for improper gait, and argentum nitricum. And I will request you one more thing, that before taking this medicine you should consult your general physician. Under the guidance of him you should take these medicines. So thank you. This is all about multiple sclerosis.